Okay, good morning, everybody. At 8 o'clock, we're calling to order the Center County Prison Board of Inspectors meeting. At this time, we will begin with public comment. I believe, Janet, you had reached out saying that you'd like to make some public comment today. So I know that Janet does. So we'll start with her and then go from there. So Janet, the floor is yours. Janet, I'm unable to hear you. Not sure if anybody else can hear Janet. Can anybody else hear Janet? No? Okay, Janet, we might need to loop back to you. Okay. Apologies about that. Uh, I'm so sorry. I'll get on my phone. Okay, she's going to call in here. While we're waiting for her, is there any other public comment from anybody else at this time? Okay. Give Janet another minute or so here to join us via phone. Janet, is that you that just joined?
That'd be Bernie.
Bernie. Okay. Hi, Bernie. How are you?
Good. How are you?
Good, good. Okay. Well, what we'll do is we're gonna begin with our approval of the minutes and monthly reports, and then once Janet joins after the monthly reports, we'll give her an opportunity to make some comments. So at this time, we'll look for a motion to approve the minutes. Motion to approve the minutes. Is there a second?
Second.
Second.
Been moved by Controller Moser, seconded by District Attorney Cantorna. All those in favor of approving the September meeting minutes, please do so by saying aye. Aye.
Aye.
Aye.
Any opposed, say nay. Motion is carried. Okay, for our monthly reports, we'll turn it over to the warden. And warden, I might jump once Janet lets us know she's joined in. I might let her know to hold off until we're done with your reports. Okay.
No problem, sir.
Okay.
Good morning. All right. Good morning, everyone. Starting off with our returning citizens services report. Center County Mental Health. Since Amy Miller's off, we have a new person filling in. She's doing double roles, so she hasn't been able to see everybody like Amy has been. But a year ago, Amy saw 25. This past year, there's 4. 0 and 0 was referred to Penn State and Crossroads. Penn State Psychological Clinic is still virtual. They've seen 14 returning citizens. Crossroads still virtual. Drug and alcohol, 7 males, 5 times per month, 3 females, 5 times per month. Mental health group is 3 males, 5 times per month, and 1 female, 5 times per month. Our Center County Compass program, we have in the male group, we have 14 returning citizens with 4 peer supports. They meet 4 times per week, 5 for the last 5 weeks. Female group is 7, 2 peer supports, and the same as 4 times per week for 5 weeks. Graduations, we had 2 males. Work release and community reentry workers, centerpiece was 2. County maintenance was 2, grounds was 2, and work release was 0. And a year ago, work release was 0. Our prison monthly report here continued with our Center County population snapshot of September 30th, 2021. Our total count that day was 187. Center County population was 123, 15 females, 106 males. Unsentenced was 82. 12 females, 70 males. County sentence was 27, 3 females, 24 males. 8 state sentence was 8, 1 females. Should be 7 males, not 13. We had 5 males go upstate on October 12th. Tennant County population 64, 21 females, 43 males. Unsentenced was 29, 16 females, 13 males. County sentence 34, 5 females, 29 males, and 1 state sentence is 1 male. As a daily population for September, you see what we had. Our Tennant County inventory, the orange is going straight across from 69 to 65, not much of an increase. Or returning citizens for Center County, we were up, then we're down. We're just kind of keeping it level right around the 124, 120, 127 area. Our Center County unsentenced population here, snapshot of September 30th of 2021. Ones are here with only new charges only. We have 34 males, 1 female with a total of 35. Here with probation parole only is 13 males, 4 females, total of 17. Probation parole with new charges is 22 males and 6 females, total of 28, comes out to a total of 80 unsentenced. Our behavior modification status, we have 7 on tier 0, and we have 14 that's out in population. Co-occurring disorder, a year ago was 24, 101 intakes. This past September is 19 out of 74, is 25.7% of our population, our intake population coming in that's battling co-occurring disorders. Only 7 were on or have not refilled medication upon intake. Out of the 19 was 12 from center, 5 females, 7 males, and 7 from out of county with 7 males. Suicide watch a year ago was 21. This past September was 12. 10 from center, there were 10 males, 2 from out of county, 2 males. 0 were detoxing. Total numbers a year ago was 23, 12 from center, 11 from out of county. This past September was 15, 4 females, 11 males, 11 from center, 2 females, 9 males, 4 from out of county, 2 females, 2 males. Substance detox by the numbers. Heroin, we had 4, 3 from center, 1 from out of county, 1 from benzo was out of center, meth, 2 from center, alcohol was 1 from out of county, Suboxone was 1 from out of county, and the multiple we had total of 6, 2 from alcohol, Suboxone, 2 from center, 1 benzo alcohol, 1 heroin benzomethane, 1 heroin benzo alcohol, and 1 benzo alcohol Suboxone. The FIMAT number, we had 1 individual that received his 2nd injection. So total inmates that received the prior to release was 25. 2nd injection prior to release is 16. Released who have returned for the following shots are 7. We actually have another one that we're looking at to start the Vivitrol injection, so that's starting to pick up a little bit more now. Prime care report, inpatient hospital was 1 for 1 day. It was 1 individual had COVID with COVID-19 test results. This was as of yesterday. Symptomatic testing was negative 78. Asymptomatic testing is negative was 630. We still have 1 positive. It's still in quarantine. I think they come off tomorrow.
I can't get on because my browser doesn't support BlueJeans here.
Total seen by physician or PA a year ago was 109.
Yeah.
It was 126. Total medical transports of outside physicians a year ago is 15. This past September is 12. Prime care report continues with the mental health clinician individual seen. A year ago was 183. This past September was 192. Psychiatrist is a year ago was 75. This past September was 95. Mental health patients on psychotropic medication for the month of September. A year ago was 107. Came out to 59.8% of our population, which the ADP was 179. This past September is 122, is 64.6% of our population, with our ADP being 189. Daily average patient diagnosed with mental health, a total of 155 out of 189 ADP. A year ago in Category C, we had 135 with 75.4%. Category D was 20 with 11.2%. This past September, Category C is 118, 62.4%, and Category D was 24 with 12.7% of our population. The mental health stability rating entire population snapshot on 9/30 of 2021. Stability code A is a total of 21, 11% of our population. Stability code B is 15, 8% of our population. Stability code C is 115, 62% of our population. Category D is 25 with 13% of our population, with a total of 176. Awaiting placement was 11 at that time, and our total population was 187. Mental health stability rating by county, starting on stability code A, blue is Center County, orange is out of county. We had 17, and that's 17 males, 4 males from out of county. Stability code B is 12, 11 males, 1 female. Out of county is 2 males, 1 female, total of 3. Stability code C is a total of 89, 11 females, 58 males. Out of county is 46, 19 females, 27 males. Stability code D, 16 from center, 13 males, 3 females, 9 from out of county, 6 males, and 3 females. Going into our inmate grievance reports, a year ago we had 16. This past September we had 31. Non-grievable were 3. Found it non-grievable was 0. Grievable was 17. Found it was 12. 2 went to the first appeal with 0 amended, and 0 came to the second level appeals. 11 was refused. Grievable found it was 12 personal property items were mistakenly confiscated during a general housing unit searches. All items were replaced. Central booking numbers, a year ago was 238. This past September was 194. We're down 44 bookings at that time. 11 to 7 shifts, processed 30. 7 to 3 shifts, processed 32 or 62. 311, processed 102. And that's it, sir.
Thank you, Warden. Any questions from the Prison Board of Inspectors members on the Warden's monthly report? Okay. Hearing none. Any questions or comments on the monthly reports from members of the public?
I have a question. This is Brian.
Sure, Brian.
Can you hear me? Okay. Warden Shell, could you go back to the suicide watch slide? I was just curious. I've been taking some adult education classes, learning more about the correction system and ministry in the correction system. I'm just curious, suicide watch, I see there's about 20 people out of about 200. Does that seem high or low to you? Is that pretty much constant? Has that maybe increased with COVID? I'm just curious about the number of people that are on suicide watch, if that seems normal to you.
Our number this past September was 12. And that's kind of actually low, per se, for previous years.
Oh, sorry, 12. Okay.
Yeah, 12. A year ago, we had 21.
Okay.
Usually our numbers, we always side on the cautious side just to make sure nobody hurts themselves. If there's any red flags that medical feels or the officers feel that there's a red flag or some words they said or their actions, we just do that until they see a mental health clinician and psychologist. So that's what we always weigh on the side of precautions with putting somebody on suicide, because we don't want to have an oops.
For sure. Of course.
Yeah, that's over a month. So they could be on for a day, they could be on for 2 days.
Okay.
So it's over the 30 days the past September that they were on. So it's not like 12 per day, it's 12 for the whole month.
So it sounds like that number at least is down from last year, so to speak.
Correct.
And then my second question, I think you already answered it. How long are they on suicide watch? I think you mentioned until they're evaluated.
So they're evaluated, and the biggest thing is that if they come in over the weekend, they have to wait till Monday to be evaluated. So we keep them on maybe 2 days, but usually they're on a day or so until they feel we get possibly medication, we get their medications corrected and so forth, until they talk to somebody and they're at a better place. Let's put it that way.
Do you have anyone that's on, I would say, long-term suicide watch? Like it's not just short-term, but they are actually in a bad spot for a while and they're not snapping out of it. Do you have anybody like that?
We haven't had anybody for a long time with that kind of status. We have some people that'll bounce back and forth just because of the daily stressors that they're dealing with.
Sure. Thank you. Very helpful.
Thank you, Brian. Any other questions on the warden's monthly reports from the public? Okay, we're hearing none. We will at this time jump back. Thank you, Warden, for the reports. Before we go forward, actually backwards, any public comment? Janet, we know that you had some audio troubles. Are you able to connect with us now?
So can you hear me on the phone?
Yes, we can.
We can.
Yeah.
Okay, great. So thank you so much for your patience. And I don't really understand because I was on a Zoom last night. So I'm not sure what went wrong, but I do appreciate your being willing to circle back to me. I did circulate to Commissioner Pipe and welcome. I'm happy to send it to other people. An article from the Associated Press from last week, which describes a substantial increase in the number of prison guards in Pennsylvania who've gotten vaccinated as a result of the state test or vaccine mandate. And I wanted to talk about that just a little bit. I'm not sure how much the test or vaccine mandate applies to Center County or county operations, and I'm assuming that it doesn't, but I would be happy to be corrected about that. Among the state prison guards, the number of people who were vaccinated almost doubled as a result of the test or vaccine mandate. And if that is the case, then I think that it might be something that the county would like to consider. Probably most of you know there was a small outbreak of COVID at CCCF in recent weeks. And this COVID outbreak took place in spite of the CCCF administration taking every possible precaution. In some cases, incarcerated individuals who had gone through lengthy quarantines and had other restrictions placed on them still got the virus. And so it must be assumed that that means that the thing that made the virus happen was out of the control of the prison administration. And one of the things that is out of control of the prison administration is whether or not the corrections officers are vaccinated. The Prison Society has an interest in this issue, partly because of the impact on the health of the incarcerated people, but it's also because when there is an outbreak, it leads to even more severe restrictions. And even if those restrictions have merits, they have devastating impacts on the incarcerated population and increases the stress level of everybody involved. But we also have an interest in the well-being of the corrections officers, since we know that well-trained, well-paid, healthy staff makes the jail a better place for everyone. And the test or vaccine mandate is a good option because it takes into account the concerns of some corrections officers who do not want to be required to be vaccinated. And unvaccinated people can simply continue to take weekly COVID tests. Also, having staff whose health is being monitored leads to more trust of the corrections officers on the part of the incarcerated people. And finally, the test or vaccine rule would lessen the chance of an outbreak, which would make managing the facility much less burdensome for our administrators. So it sounds to me like it's a win-win for everyone. I am aware that there might be some issues, but I did want to bring it up for your consideration. So thank you so much for your time.
Okay.
I'm finished now.
Okay, thank you, Janet, so much for your comments. We appreciate them. All right, and we will have a report from the warden on a vaccine clinic a little bit later on, and I think we can address and discuss this a little bit more in depth from our side of things, okay?
Sure, that sounds great. Thank you.
Okay, thanks, Janet. Okay, so we'll now move into old business and turn it back over to the warden.
Thank you, sir. With our COVID correctional facility operations, I thank the commissioners for approving a short and long-term refrigeration rental from Polar. This will help us be able to actually cut out the middleman to be able to buy any of our chicken, hamburger, turkey, and so forth directly through those providers. And then we're able to carry a lot more than what we're able to carry right now, so we don't have to worried about our inventory or about when our deliveries are going to happen. Sometimes our deliveries don't happen on a weekly when we need it weekly. So with this refrigeration, it will give us that longer term that if a delivery can't make it next week, at least we can make it to the following or 2 weeks out with our supplies. So Kevin Brindle's very happy. You can see the big smile on his face there in the picture. He's very pleased about this. This is something that he's been looking forward to receiving, to be able to have more supplies on hand just in case of deliveries. So I want to thank the commissioners for that. As we continue back through our program and virtual meetings, we're still continuing everything virtual. Phone calls, in persons is only Compass for Men, Center County Mental Health, and probation assessments and so forth. Through the non-contact visiting room, we're still continuing our service here, our videos through Access Church Services, and as we're still waiting in process of adding our leadership program and Inside Out program with Penn State University. Our COVID vaccine, September 30th, it was a 6th COVID-19 vaccine clinic. Moderna was 9 returning citizens, and Johnson was 8 returning citizens. The 7th vaccine clinic is going to be somewhere around October 29th of this year. So there's our numbers there. Our total numbers for incarcerated individuals is probably right around 80 individuals. And what's ironic with our last little hiccup with our positive cases, we were able, out of 34 individuals, we had 12 that came up positive. We were able to we acted in a very appropriate manner by separating everybody where we continue to have only 22 remain negative out of the 34. 6 of those were fully vaccinated, and 3 had their first vaccination. The 12 positive out of the 34, 2 of them were Johnson & Johnson vaccinated, and 1 of them had their first Moderna vaccination that came out positive with COVID. So, so we're just still doing our protocols with monitoring everybody. Doing checks with our officers as well, and giving anybody and everybody a rapid swab that is requesting one, or we feel that they deserve one in the sense of that they have a symptom. One other thing here, just with old business, is inmate request form. We received this individual from a person that was being released. She just wanted to let us know, just a quick note to let you know that you have some great and compassionate COs. The care and support that I received from Rupert, Posey, Harvey, and Parson, oh yeah, and Dickey has been a great help. I am forever grateful to them, as they have made my time here easier. Gresh is cares, and Officer Gresh eventually will be another great CO. Thanks. I'm hoping I do not have to come back for these charges. Just showing that this is a nice appreciation that our returning citizens kind of give us a note, let us know how our officers are doing. This is just one good note that I'm pleased to hear that our officers are doing what we as administration kind of display out to them, how we want to treat the returning citizens. That's it, sir.
Thank you, Chris. I think it's important to highlight this positive feedback. So thanks for bringing that forward. Just to jump back quickly to the vaccine update and clinic, is Boalsburg Apothecary still doing the clinics up there?
Yes, they're still participating in there.
Okay, fantastic. So somewhat related to the comments that were made by Janet, I think one of the things that might be helpful for the prison board just to appreciate and reflect on is if there's a way that you could maybe in a future meeting provide us with what other counties throughout the Commonwealth are doing as it comes to vaccine protocols for their staff, testing protocols for their staff, may be helpful for us just to understand a little bit about what's going on statewide. I think there's been less and less outbreaks that have occurred throughout, or positive cases that have occurred throughout the state, with more vaccines becoming available. But I think at least it'd be helpful from my standpoint. I can open it up for any other prison board members that would also find that helpful, but I think that might just be helpful for us to understand and appreciate as we go forward. But I'll open the floor up to any other prison board member comments. If there's not enough consensus on learning a little bit more about that, we can table it, but just wanted to see what everybody would think.
This is the, oh, sorry. Go ahead.
Thank you. This is Judge Oliver speaking. I just wanted to say that I agree, Commissioner Pipe, that makes a lot of sense to see what others are doing, and so I would fully support that.
Thank you, Judge.
I would just concur with that as well.
This is Commissioner Dersham. I would appreciate the fact that the information would be useful, but I am diametrically opposed to forced vaccination. Just so you know, there's too many people within our organization that have already acquired immunity through COVID exposure, and I just don't think I can support that. So just want to let you know.
Thank you, Commissioner. And I think at this point, I haven't heard of any mandatory vaccinations. I think the thing that Janet was bringing up, which has some merit, was to vax or test, which would allow individuals not to get vaccinated, but they still would have to go through a test. But I appreciate your views. Thank you.
I just wanted to make that clear where I'm coming from.
Absolutely understood. Okay.
Hey,
I agree with Judge Oliver. Let's see what our other counties are doing.
Okay. Thank you, Commissioner.
This is Bernie. The policy in and of itself, I think, makes sense. You test or you vaccinate. I think the real question is whether it's going to have a negative effect on the warden's ability to keep this place properly staffed. I mean, the policy makes sense, but we also have a real life issue that needs to be addressed. So I'd be open to more information, but those would be my thoughts as we sit here today.
Thank you, Mr. District Attorney. I think I agree. One of our concerns from this get-go with the pandemic has been, even as people would test and we would do asymptomatic testing, if we do find out that individuals are in fact positive but asymptomatic, how do we then operate the facility? But I think if they're positive either way, we would still want to, find that out. But I agree. With the staffing challenges we have, we want to be very mindful about what this would look like and the impact it would have on our facility. So thank you for making that great point.
Commissioner Pipe, I have one thing.
Please go ahead, Warden.
Just letting everybody know that there's other facilities that are at a disarray with COVID right now. Lancaster County is just coming out of a very bad cases in their facility. And just talking with the other facilities as well as it's when COVID came into Pennsylvania, it came in from basically the north down, and when facilities start getting more COVID positive cases in their jails, it was coming from the north. With the Delta variant, Maryland got hit the hardest through their correctional facilities, and then it came up from the south, and Lancaster as well as Cumberland County had some bad cases in their facility. And now Huntington was just informed us this weekend they have another position that they're battling COVID within their jail really bad. It was almost a year ago that we took those inmates, those returning citizens as well, because of no staff and everybody was out with positive COVID. So they're at that point now that we don't have to take they're incarcerated at this time. However, they're not at a good place either. So I think with my team here and our medical staff, when we find out that somebody's positive, we react pretty quickly and separate that it doesn't spread like wildfire and like it does in these other facilities. And I thank my staff for that.
Thank you, Warden. Okay, so it sounds like we do have consensus to get some more information. I think a presentation at the November meeting would be helpful, and that could even be sent out prior so that the prison board could just get a little bit more information on it ahead of time. But it'd just be helpful to look at and consider as we go forward. Any other thoughts on this from the prison board before we move forward? Okay, hearing none. We will continue then with our. All right.
Question.
Oh, no, sure. Brian,
Mr.
please.
Commissioner. Warden Shell, Clearfield Jail. Do you know anything about Clearfield Jail? How they're doing with COVID? I'm just curious.
We haven't heard anything recently at this point, so I do not know what their status is, if they have any positives at all. I know they're doing a lot of revamping up in that facility with the new warden in. They're doing new trainings and so forth. So their cases with COVID, I do not know, sir.
Thank you.
Okay, thank you for the discussion, everybody. It'll be helpful as we go into our November meeting to learn a little bit more about how other facilities are doing, but also what kind of protocols and policies they have in place, and we can, again, learn a little bit more before we move forward. Okay, all right. And then new business, we are excited about learning a little bit more about the implementation of decision points and how that's looking.
Yes. We had decision points finally. It was almost a 2-year process of trying to get decision points in, which was through our Stepping Up initiative. The national came in and Stepping Up, it said that decision points would be a nice additive for our mental health. So all of our counselors went through we received a grant. Carrie Hall, I appreciate your help through that, receiving our grant to be able to have this happen. So all of the counselors went through this. Glenn, my deputy, as well as myself went through this. We reached out to other counties. Butler County brought 2 individuals in, and Cambria County brought 2 individuals in. The 2 people in the front there, the gentleman with the shield, Mr. Swisher and Janina, they were our facilitators. They were great through the whole process. We were able to split the room up and be able to have 2 different rooms for our classes and be able to accomplish decision points. And it was a lot of information thrown at us for 3 full days, but it was actually enjoyable being in class, learning about decision points and so forth. So I'm just going to go through a very brief of what it's all about. The counselors, Danielle Menarchek, that does Compass, she's very excited about adding this to the program of Compass as well as a second option. Danielle Fox, our mental health, she's eager to start. We're going to start next week. We're actually going to start next week the program. Our mental health, we're starting out small with the male group for 3, and then we're starting out with our male group and female group in Compass as a small group to start this whole program. So I wanted to go through it just to see what it's about. I've read a lot of good things about it. Mr. Swisher and I have been emailing back and forth, as I said, for the last 2 years. I like to be on point with everything because I'm hoping I'll be able to lessen my schedule a little bit, be able to go back into classes and participate with the classes. I think Glenn's the same way. He feels that we can be invested here and show our staff that we are invested in this program. And I think they're all for it. So everybody, it's co-facilitated. So everybody, we can all help. Director Height was in it as well. So we're all ecstatic about starting this program. Just starting off, the biggest class rules, we have 3 rules in the classroom. It's be respectful. And that's when they come in here, no matter what somebody's opinion is, no matter what somebody's story is or how they got to where they are today, is about being respectful and supportive. That's our number 1 rule. Our second one is participate. They must participate. That means being active, sharing stories, sharing, just assisting one another, helping one another, just being respectful and participating and make an honest effort. We all make mistakes, and when we're in classes, sometimes we say some things that might not sound appropriate or it sounds kind of dumb, like there's no dumb questions, but make an honest effort. So that's one thing we're trying to get across. That we all say some weird things at times. We all say things, but we all want to be respectful, participate, and make an honest effort through this. The biggest, how we start off with decision points is understanding the trouble cycle. So everybody knows the risk situation. The risk situation is I'm going to sell drugs, for instance. That's your risk situation. So as the trouble cycle goes down, you have thoughts and feelings. Should I do it? How does it make you feel? So that's your thoughts, your mind, your feelings is what that point being in your stomach. Does it make you upset? Does it make you feel good? So that's what creates where you have your risk situation, and then you have your thoughts and feelings, and through your thoughts and feelings is where you get your actions. Do you sell the drugs or don't you sell your drugs in that? So what we're making people do before you make that action, you got to respond, other response. What that means is your family members, your children, your friends, your peer pressure, how's that going to weigh on if you do sell the drugs, for instance, and then it just cycles up. So what we try to present to these individuals through this class is where do we break the trouble cycle at? So our next step in breaking the trouble cycle is there through thoughts and feelings. So when we can make that decision point through the thoughts and feelings, knowing that, hey, this doesn't make me feel good, let's not have that action, and then we look at the other response to your family members or what the impact is to others that care about you, that's where you stop it as well, that it doesn't go back into that risk, that you don't have that cycle, that continuous circle and revolving doors, you once would say. So that's where we make those decisions, and through these active pages, there's 4 pages that you have to for homework, and through those 4 activities, it starts to make you really think outside that box of how to readjust your thinking and so forth. So like step 1, identify my thoughts and feelings. So what we want everybody to realize is when I identify my thoughts and feelings, what am I thinking and feeling? What are these thoughts and feelings leading me up to? Step 2, think about others who care what I do. Who else cares about what I might do? What would they want me to do? So that's step 2. Step 3 is thinking about choices. Pick one. What are my brainstorm choices? Which choices lead me away from trouble? And which choices can I feel okay about doing? And step 4 is identify a motivating thought. What is a thought that I can motivate myself to make the right choice? So as we continue down when we continue, their first project is, or their first homework assignment is step 1, reporting, is identifying my thoughts and feelings. So what they do is, in A, they do a risk situation. What is my temptations, or what is happening that I don't like? Is it selling drugs? Is it doing drugs? Is it stealing a car? Is it stealing a candy bar? Whatever it is, they put the situation there in A. Then they say, okay, how's that make you feel? It can make you feel great. I like the high from the drugs, or you know what, I get sick after I have withdrawal. So they put their thoughts down through there. Then there's their feelings. Does it make them happy? Does it make them sad? Does it make them feel undeserving? And from there, then step D is what offending, harmful acts could these thoughts and feelings lead me up to? So through those thoughts and feelings, will they do the risk, the act, or not? And then they write down what they do. So if it says, yeah, I did the drugs, and they got a star, what thoughts and feelings clearly led to them being that trouble? So then we move on to the next week is step 2, and they act this stuff out. So they're going to get up front in front of everybody, and they're going to act these situations out and show them. And as they got to touch their head as they're thinking, their thoughts and their feelings, and they're thinking about this, and it's making them think, how does this really make you feel at the end of the day for this risk assessment? Then going into report 2 is think about others who care what I do. Name the persons in column 1 and identify what that person would want you to do. So for instance, if we're saying they're doing drugs, so who does that affect? And that's what we want to make them think. It's just not what they themselves or their friends, but what about their mom? What about if they have a child? What about their uncle, their aunt, their friends, say they're going to school, their professor, what would their counselors or their probation officer think? And they have to write those down. And then what we do is when they present that, they start with step 1, they present that step 1, then they go into step 2, and they present that as well. And just making them think who cares about them. And sometimes inside corrections here and being incarcerated, sometimes they feel that nobody cares about them, but there's we have a whole list of things how we try to get them to start thinking about people that really do care about them, and we do care about them as well, and just putting that out there with them. And then we're going to step 3, and that's thinking about choices. So that's why we have a red light, yellow light, and green light. So the third report that they do for the third week is think about choices. Pick one. Brainstorm your choices in column 1. In column 2, code it. Red light is a good chance that will lead you to trouble. Yellow light, be careful or may be able to lead you to trouble. And green means good chance to keep you out of trouble. In the last column, indicate the green and yellow actions that you can feel okay about doing. Put a check mark if you could feel okay about it. Put a question mark if you're not sure how you feel about it, and put an X if you cannot feel okay about the situation or the act. So as you said there, that what we try to convince them is they got to identify what clearly leads them to trouble, which is a red light where it means a stop light. You might want to get your mind thinking to stop. The yellow, it could lead you either way. It could lead you to the trouble or lead you away from the trouble. And of course, green light clearly leads you away from trouble. And that's one thing we want to let them think on their own and act it out on their own to see where they're at. And of course, it's participation with the entire class. So everybody's going to give their thoughts and opinions about everything respectfully to each other. And then we're going to the last step 4. This is if they completed all the first 3 steps and they complete the step 4. This is their graduating. What they continue to do is identify a motivating thought. So brainstorm thoughts that will help you do the choice you identify in step 3. Star the thoughts that you can imagine will work best for you and that you are willing to try. So what we try to do is make motivating thoughts. And motivating thoughts is if you want to do the drugs, what keeps you away from the drugs? Say you have a child, that's a motivating thought. You have your family at home, that's a motivating thought. I'm tired of being incarcerated is a motivating thought that I want to change. And you just go down through the list. And what we try to do is make them have as many as possible they can motivating thoughts. And then you got to star one that really is going to fit their identification of how it's going to change their thinking thought process by doing this. And that's the end of the short of the story. Like I said, it's about an hour and a half class, possibly 2 hours, depends on how many participants you have and how they act each step out. Like I said, I would be here another hour just going through all the paperwork, but it's really entertaining in the sense of trying to get people to think, and even made us think as well. And I don't know if Glenn has anything to say, if I touched on everything.
Yeah, I think you did everything.
So Glenn, like I said, it was really, really a great class, and we're very motivated to get this started. And it's just realistic. Everyday's lives, we make choices and we make decisions. And you really don't realize till you go through those steps, as Glenn and I went through the class with everybody else, that, the decisions we make, we do think about them. We do have that gut feeling. So all these steps you actually do in life itself, it's just you got to put it on paper and actually really makes you start to think. So if anybody has any questions, I'm free to answer at this time.
Sounds like it'll not only be beneficial for the folks who are incarcerated, but also for the staff that went through the program, Chris. It sounds like there were things that I assume if the prison board would go through it, we probably would find useful things that we just take for granted or don't think about. So thank you for your leadership and everybody who was able to join, in addition to the reentry trainers, counselors, I should say. So yeah, that's a great presentation. Really think it's going to be an evidence-based thing that we can use for our folks there. So thank you. Any feedback, comments from anybody from the prison board on the presentation today?
No, just it looks like a great program, and thanks for sharing that with us, Chris.
Okay. All right. And then any questions from members of the public, comments from members of the public?
Kathy from Centerpiece. The only thing I would say is I love this. I appreciate it. I appreciate having the information, and anything we can do on our end to reinforce things like this with the guys that we work with would be wonderful.
Thank you, Kathy. We are going to give a short training to all the staff about this so they understand, because we are going to expand this out. We're going to enter into our general population as well, but we want to start out small and try to get control and make sure that we're doing this the right way, and then expand it outward for all of our other returning citizens. So that's one thing I'm pleased about. So, I mean, we're going to take baby steps right now, and then eventually, hopefully in a year or so, we'll be giving this out to everybody in our correctional facility.
Great, excellent. All right, thank you very much, Chris. We will then move into our monthly reports here. I'm sorry, not monthly reports, our other reports from our partners. All right, so we'll start with Carrie.
Morning. Just a quick update in regards to Center County's drug overdose statistics. So I just got an update from the coroner's office this week. And as of October 12th, we currently have 7 accidental drug overdose deaths and 1 suicide by drug overdose. To put that in perspective, last year at this time, we had 17 total drug overdose deaths. That would follow suit with our pattern. We typically go up and down every other year. So this is on path to be our lower numbers compared to last year, where we ended with 18 drug overdose deaths. So it's interesting. We don't quite fully understand why we fluctuate every other year, but that's been the pattern since at least 2013. So, but by all means, definitely even 1 drug overdose death is too much. So we do try to do the best we can to help in those areas. Is there any questions?
Okay, thank you very much, Carrie.
Thank you.
And from the Prison Society, Janet, we'll turn it over to you.
Yes, hi, thank you. Connie is away this month. I do see that Mark is on the call, so I'll invite him in case he has anything else to say. I want to echo other people in their praise of Decision Point. Gordon, it's a great program, and look forward to seeing you roll it out to everyone. The parenting program will take place again from October 30th to December 5th of this year, and it is still virtual, and thank you for facilitating that. I also wanted to mention that the State Department of Corrections is now considering adopting this very same nationally recognized parenting program, and so it's nice for Center County to be the innovator once again and have the state following us, and so we feel really good about this as one of the things that we can take credit for. And that's pretty much all I have. I'm not sure if Mark has anything to add or not. I just wanted to make sure.
Just wanted to add real quick to follow up on the form that Warden Shell got about complimenting staff. I hear those kind of things often. And so I appreciate the staff, and I appreciate what you're doing to keep COVID under control. Yeah, keep up the good work. Thank you.
Okay, thank you to both Janet and Mark. And then Kathy, we'll turn it over to you from Centerpiece.
Yeah, I'll be brief. Just a huge thank you for keeping everyone safe, and so grateful that we have 3 trainees. I guess 2 now. 1 got out, which is nice. 2 trainees coming. So thank you very much for working with us on that.
Okay, thank you so much, Kathy. We are at the end of our agenda. We do want to mention that due to Veterans Day taking place on the 2nd Thursday of November, we will then be scheduling our Prison Board of Inspectors meeting for November 18th. So it'll take a little bit, be a little bit later in the year, but we do want to mention that and remind everybody about that. Any other announcements from you, Warden? Anything we needed to announce before adjourning? Okay.
No, sir. No, sir.
All right. Thank you, Warden. All right. It is now.
Real quick question. I'm sorry.
Oh, sure. Yeah, Brian.
Michelle, I may have missed it. Have you had any update on replacing Lorinda? I know that was a concern on staffing shortage, and you guys are having to pick up some of that. I just want to know if there's how that's going.
Yes, Vanessa Billett. She started the 26th. She had 1 day in, and then she started the decision points, and so we had a lot thrown at her right away. We do have probably about 3 in the pipeline of community reentry. So she's doing good. We actually have one going on work release today. So she hit the ground running. So I'm very pleased.
Oh, that's a praise. Thank you.
Okay, so it's now 8:50. We would look for a motion to adjourn our Prison Board of Inspectors meeting.
Motion to adjourn.
Second.
It's been moved by Commissioner Higgins, seconded by Controller Moser. All those in favor of adjourning, do so by saying aye. Aye.
Aye.
Motion carries. Thank you, everybody. Have a great day.
Thank you.
Thanks, everyone.